Hello, welcome back to the channel. Thank you so much for joining me today. Make sure you watch till the end to see the sources and verify this news for yourself. And if you haven't already, please hit that subscribe button and turn on the notification bell so you don't miss any updates on what's really happening around South Africa. Now, today's news is quite an eye-opener and one that has many South Africans talking. Dr. Aaron, a well-known health expert, has finally broken his silence on an issue that's been quietly troubling the nation, the smuggling of South African medicine out of the country. According to him, there are people who are actively involved in stealing and illegally transporting local medicines across borders, creating serious shortages in hospitals and clinics. This revelation reportedly came after an incident at an accident scene where packets of hospital medication were found among items being transported. Dr. Aaron, visibly disappointed, didn't hold back. He said authorities are fully aware of those smuggling our medicine, and investigations are underway. He stressed that these activities are not only criminal but deeply harmful to ordinary South Africans who depend on public health care. Imagine going to a government clinic only to be told the medicine you need is unavailable, not because the government didn't order it, but because it's being sold in another country for profit. That's what's happening, and it's heartbreaking. According to reports, some of these medicines are meant for public hospitals and are being stolen from storage facilities and clinics, often by people within the system. These drugs are then taken across the border to countries like Zimbabwe, Mozambique, and Lesotho, where they are sold illegally. Dr. Aaron explained that the government is tightening security at medical depots and increasing audits to trace where the missing stock ends up. He called on all citizens, especially healthcare workers, to report suspicious activities, saying that protecting public healthcare is a shared responsibility. Many South Africans have expressed anger online, saying this kind of corruption and theft is unacceptable. One user commented that people stealing from hospitals are just as bad as those stealing from the poor. Another said it's painful to think of loved ones dying in hospitals because medicine is missing while others profit from it illegally. The situation highlights a much deeper problem, not just theft, but how criminal networks are taking advantage of weak systems. Some of these groups reportedly use ambulances, delivery trucks, or even accident scenes to move the stolen items undetected. That's why when Dr. Aaron mentioned the drugs discovered at an accident site, many people were shocked but not entirely surprised. It's become clear that the black market for medicine is thriving, and it's costing lives. He also noted that South Africa's medical supply chain is under heavy strain, with demand often exceeding supply. So, when medicine meant for public use is diverted, the effect is massive. Patients with chronic illnesses, like diabetes and hypertension, end up suffering the most. These are the people who rely on the public system every month to get their medication. Dr. Aaron urged the government to enforce stricter border controls and work with regional partners to stop these smugglers once and for all. He said South Africa cannot continue losing essential drugs to criminals while citizens go untreated. He also hinted that more arrests are expected soon, as law enforcement closes in on key suspects. Of course, many people are calling for accountability, not just at the bottom but at the top too. They want to know how such operations could happen for so long without strong intervention. Some health activists have even said this problem may be linked to corruption inside medical distribution systems. The issue of stolen medicine also touches on South Africa's wider problem of illegal cross-border trade. Whether it's stolen goods, fake products, or illegal medicine, it's clear that stronger border management is needed. And let's be honest, these smugglers don't care about anyone's health, they care about profit. But as serious as the matter is, South Africans will still find a way to make light of it. One person joked online, saying, "We've heard of people smuggling gold, diamonds, and even cigarettes, but medicine. Yo, now we've seen it all. Another added, imagine explaining to someone that Panadu has become a high-value export item. It's funny on the surface, but it also shows how desperate and creative some criminals have become. At the end of the day, Dr. Aaron's statement serves as a strong warning that this kind of crime won't be tolerated anymore. The people stealing these medicines are stealing lives, and the government intends to hold them accountable. It's time for everyone to play their part, whether by speaking up, reporting suspicious behavior, or simply staying alert. Thank you for watching till the end. Please make sure to subscribe to the channel for more news and updates from across South Africa. Share your thoughts in the comments. What do you think should be done to stop this medicine smuggling problem? All images used are for illustration purposes only. Sources: News 24, IOL, Times Live, Sowetan Live.